Hello friends, welcome back. If this is your first time here, my name is Joint Perez. I am an Army medical recruiter. In today's video, I have the opportunity to spend some time with Major Sharp. He is the program manager for the Interservice Physician Assistant Program, the IPAP program. This video is long, so make sure that you have a notebook and a pen to grab some notes. And also, stick all the way to the end for a good surprise. Now let's get to the presentation.
So let's get started with my briefing. All right, these are all the things that are on this slide, and we're not necessarily going to cover all of them. Well, most of them, though. Sergeant Perez will get to most of them a little bit later. And I am the program manager for IPAP. These are the current program managers for ACP as well as SP Core. And the SP Core, in particular, Major Maggione manages, for example, the occupational therapy, physical therapy, and nutrition folks that are applying through that program. So, as is the case with anything, where do you start, right, as it relates to IPAP? How do I get started down this journey? I cannot tell you how many emails I receive, people saying, hey, I'm very interested in this program. Where do I start? At the beginning, clearly, right? But before you start, I recommend that you research the profession. Make sure that you really understand what it is that a PA does. And the best way to go about doing that, in my opinion, is to meet with an officer of the profession. Notice I changed that. It's not someone in the profession, an officer of the profession. Because there's a difference between being a PA and being an Army PA. Very big difference, right? And we'll cover some of those a little bit later. So I would recommend that you talk to an Army PA about what it is that they actually do. That will help you decide, hey, is this actually what I want to do, as well as help you prepare your packet moving forward. Definitely talk to your friends and family more than friends, about the potential commitment, about what's coming. Because for 29 months, if you're selected, for 29 months, you are going to be owned by this program, okay? You are going to be very, very busy. And, the things that you were able to take care of or contribute to or be part of in the home are going to be significantly diminished, right? An average day is before class, you show up an hour or so to do some studying. And then you're in class all day, 7-8 hours. And then when you're done, then you hang out later with the group to study some more about everything that you just did. And then you get home later, and then maybe the significant other is almost ready for bed, or if you have kids, the kids are already in bed, that kind of stuff. And that's most days for 29 months. So it's tough. And what you're asking the other person to do is to really carry the load while you're doing this. And it can affect things like family planning, right? Like maybe right now is not the right time for us to expand our family. So letting the other person know what's to come is important, will be important for you in your decision making. And then lastly, meet with the ed counselors. These are the folks that know a lot about this program, a lot about how to help you apply for this program. They can sit down with you and help you, one, understand, is this really what you want to do? Or what you're describing sounds like maybe something else? And then once that's established, well, where do you really stand right now? And then help you develop a plan moving forward to get to where it is that you want to be. So what's an Army PA? People, we think we know what a PA is, but what's an Army PA? Most important thing I can say out of all of this is you are the Role 1 and Role 2 subject matter expert in the United States Army. I know there are some meadows that might argue and say, well, that's it. But the reality is that all things related to medicine below the Role 3 is your area of responsibility. You are the one that a battalion commander, even a brigade commander, will look at and say, okay, Doc, tell me the plan, what's going on, right? Now, there are MSC officers, meadows, who that's their job is like the medical planning piece and things like that. But at the end of the day, that's not who the commander looks to for what's going on, what's the plan, help me understand, and give me confidence in what's about to happen, right? That's coming to you. As a former NCO, right, we've heard that NCOs are the backbone of the Army, and I believe that very much. I also believe that PAs are the backbone of the AMET. when you look at who touches the most patients and delivers the most health care across the board by AOC, hands down, it's us. Go to a TMC today, tomorrow, whenever, to go get seen for anything. Who are you going to see? 90% chance you're going to be seen by a 65 Delta, a PA. Your doc will be the one taking care of you, right? And that's just how the Army functions, particularly on the line side of things. When we talk about the duties of an Army PA, I think it's interesting. The first thing listed up here, provide advanced trauma management. You can see all this other stuff, right? Normal medicine stuff, conduct physical exams, order diagnostic imaging, labs, things like that. But why is the first thing up here listed, provide advanced trauma management? Because unlike a PA, an Army PA has dual roles. One, I take care of you in garrison. I'm checking your cholesterol. I'm getting you to physical therapy because you have an injury. I'm doing, general medicine to help you, otherwise stay healthy, right? And contribute to the fight. But when we're in the fight, my primary function is to be an expert at advanced trauma management. Because when you come and see me and we're in the fight, there's a good chance that you've got holes in you, you're missing pieces, whatever the case might be. And my job, my primary function is to keep you alive for an extended period of time until I can move you to a surgeon, trauma surgeon, or somebody who can then do definitive care and save your life, right? That's what makes us different than just a PA. And you're going to see, if selected through your time as a PA, constantly there are going to be courses offered to you, right? Burn management course, right? Jungle medicine course, CBurn course, all these fantastic courses specifically for care on the battlefield to take care of people and keep people alive in different environments. When we look at kind of the cycle of the application period, I recommend everybody, first and foremost, read 601-20, AR 601-20. That is the regulation governing application to IPAP. Now, it's a little old, right? It's a little old, and every year we release a brand new MIL-PER that gives you the updates. Read 601-20 first. Read it top to bottom, all right? Then read the most current MIL-PER. If those two happen to disagree on a point, it's the MIL-PER that's accurate. The MIL-PER is telling you what to do, okay? The reason why I say that is because I receive many emails from people saying things like, I don't know where to start, or what should I do about this, or how do I do this? And it tells me they never read the regulation, they never read the MIL-PER, because it's very, very clear in there. It tells you exactly what to do. So it'll save you some time, save me some time by just reading. And then if after you've read through everything, you understand it, and there's still questions, sure, ping me. I would love to help you. Also, we talked about TA. On the IPAP website, on the AFPIMS website, about center-ish or so of the page, there's a link for you to go fill out some information and to get a TA form from UNMC, right? The University of Nebraska Medical Center. On that, they'll generate the memo for you, and it will tell you these are the classes you must have. These are the required. These are the recommended. Which ones is TA going to pay for? Required, not recommended. If you want to take the recommended, that's cool. That's on you, right, to take them. But they will pay for the prerequisite requirements.
Would you like me to go print out some MIL-PERs I got on my desktop? Current MIL-PER for the IPAP?
No, sir. Thank you. It's fine. The application window is 1 October through 1 March, which means if you send me your packet on 1 October, I will accept it. If you send me your packet on 1 March, I will accept it. If you send me your packet left or right of those dates, I will not accept it. Okay, I can't. That's what it's spelled in the regulation. It will tell you, right? These are the dates. It's really important to pay attention to the dates. Let me stress this again. Dates are what get packets disqualified. More than anything, dates get packets disqualified because people missed timelines, missed required dates, and I cannot accept the packets at that point. Okay, pay attention to the dates. Also, we live in a digital age, right? Everything's like now, click a button, get something now. But bear in mind, despite our technology and how quick things are, for whatever reason, transcripts are always lagged. It always takes a while. You put it in the request to wherever, and it takes them 2 weeks, 3 weeks, 4 weeks before they get it to where it needs to be, even though it's all digital. I don't understand. And, even with your PA CAT, you take it and it takes X number of weeks before the results are available. Or your SAT takes X number of weeks before the results are available. These things are important because if those things are not available at the time of the board, your packet cannot go to the board, right? The board doesn't have it to look at, so your packet's disqualified. Again, dates are important. So, for example, your SAT has to be current as of 5 years, and we'll go over that. So typically in the MILPER, it will have the published last possible date for your SAT. You must have completed your SAT by X date. And that gives us time to go in. We go in, we look at your scores, we can pull them down and whatnot, and then put it in your packet for the board. So it gives it time for the results to post. But if you were to take it after that date, right, there's no guarantee that your results would be available. And if they're not available, guess what doesn't happen? Your packet doesn't go forward. A year's worth of work is kind of ruined at that point. So follow the dates. Now, is it possible to take it after that date? It's possible with exception. I can grant exception, right? But again, there's no guarantee you're going to get those results back. So definitely recommend take it not later than the posted date. And I would also say that there are minimums. You'll see that we'll talk about the minimums. I would recommend to someone that they do an SAT study, right? Prep prior to, maybe take an SAT October, November timeframe. Let's see what that looks like. Hey, I got a great score. Cool. I'm going to ride that pony. Oh no, I didn't get a great score. It still gives me time to do more prep work and do a retake on the last date if possible, whatever. So then maybe I get a better score and that's the one that moves forward to the board. I don't recommend to anybody they wait until the last possible day. Okay. This year we had, I forgot if it was like 2 or 3, that I think it was 2. They had it scheduled. I think it was at the Ed Center. And then they let me know right away. There was a problem with, I think it was like the fire suppression system and sprinklers or something. And like they couldn't take the test. So we got confirmation that no, the test site there was a problem with the test site and they could not take the test that date. Okay. I approved for them to take one in May. And again, it was with the understanding, if we don't get these results back in time, I'm sorry, but there's nothing I can do. Your board or your packet can't go to the board. Okay. Your PA CAT, I'll stress this as well. It says it must be, that's one of the things here. It's like, oh no, I could take it at another date as long as I get the results. No. It says in the MILPER must be completed by 1 March. Okay. That needs to be done by 1 March. Again, lots of opportunity for that. I understand with the SAT, there's sites where you have to do the tests. There are only certain dates, whatever. Your PA CAT's like a bazillion opportunities. Okay. So don't wait till the last moment on that. The board will meet the first week in June every year. And this year it will be 3 through 7 June. Once the board's done on the 7th, I get the results from the board's officer, and then I can start compiling the information and start getting it ready for publication. It takes me 30 days, okay? I don't publish the results for about 30 days. The reason being because I need to verify name by name every person that was identified for selection and confirm their eligibility again before I post the results. Because if I go and I post the results and say, congratulations, you've been selected for this program, and then later on I find out, oh, wait a minute, they actually didn't meet it, I can't pull that back. I can't take that back. Okay? You were offered a seat in this class. I can't take it back. So I got to make sure that you're eligible, right? And then also I have to reach out to your branch managers. You'll all have a conditional release from branch, right? Saying, yeah, you can do this. But I got to reach back out and say, hey, listen, there were no significant changes to their status. Everything good, right? We're good. This is the class date that I'm looking to put them in. Everything sound good? And every once in a while, I'll get somebody and branch will say like, no, actually this person went to Special Forces Pipeline like during this time and they're no longer interested in IPAP. Okay, let me take them off the list. Now we're going to move to somebody else. So it's just a lot of confirmation before I put this messaging out. So please, right? You put your packet in, you go to the board and stuff, and you know when the board closes. Please don't email me like 3 days after the board going, hey, you got those results yet? Like, no, man, I don't. But I will get those to you. They will be out in public knowledge here soon. And actually, like I said, they're released about 30 days later, first weekish in July, depending on how long it takes to get everything together. Also around that time is when I'm going to publish the next year's MilPer message, right? We go in, we do the revisions, and hey, these things have changed, et cetera, and then it's pushed out around that time. And then the classes themselves start January, April, and August. This hasn't changed in a bazillion years since like the start of time. It has always been this way. And so please don't think that like, August doesn't work for me. Can we move to September? Like that's not even real. That doesn't exist. Okay. These are the hard dates. Now you do have input as to what days you start, right? We'll talk about a form in here where you say, hey, these are the dates that work for me and the classes that work for me. Please understand. I'm going to do my very best. Right? Hey, I got kids. August works great. Okay, cool. Let me, and then you can get your kids into school as you transition, whatever. That's fine. But I understand everybody wants the first day. Everybody wants January. I mean, 90% of everybody requests January. But given that January accounts for 40% of the total class that can attend, 50% of those applying are going to be dissatisfied. It just kind of is what it is. So phase 1. The didactic phase. This is everybody goes to JBSA. Everybody goes to San Antonio. We're all sitting in the same classes. Every service, Army, Navy, Air Force, Coast Guard. We're all in the same classes, taking the same classes at the same time in one theater in one room, whatever the case might be. During this time, this is 64 weeks. In 64 weeks, you are going to receive 3 years worth of medical school model education. This is the hardest part of this entire program. This is where the most people fail out. This is where it gets the most challenging. I said like you're not going to be as present because you're going to be studying a lot, right? That's this piece. On average, you could expect 2 tests a week, so Tuesday and Thursday, every week for 64 weeks. That could wash you out of the program. Right? You go and you BOLO one, and if that course is not recoverable because it's graded it's a college course, right? So it's like, hey, you have 3 exams in anatomy and physiology, and if you BOLO one and it's not recoverable to a B for your overall grade, then you have failed. So again, there's some stress there. Luckily, fantastic staff. Fantastic educators, right? So the failure rate's way lower than it used to be when I went through. It was you fail, you're gone. There's no recycle. There's no other option. You're done, right? And now that's not necessarily the case. And then also the selection criteria for those people coming in, I think they've really honed it down and made it really, really good as it relates to identifying the characteristics and the factors that help identify people who will be successful through the program. So now, like the washout rate is a lot lower than it used to be. Now, if you look up here, 2,400 contact classroom hours, A&P and chemistry and stuff, does any of this sound familiar? You're like, yeah, I had to take it to qualify, and now I'm taking it again? False. You're not taking it again, because this is totally different, okay? This is medical school equivalent anatomy and physiology, okay? Very, very different. Things you've never heard of. You've never taken this class. You've never done this before. I promise. Okay. You're going to be taking, it's not just chemistry. It's biochemistry. It's biochemistry for medicine, which again is very different than even just the biochemistry that you took before if you happen to have taken it. Phase 2, this is where things get very different. In phase 2, this is your clinical phase. For anybody who has a medical background, went to AIT, whatever the case, clinicals are where you put your hands on patients, right? Where you start taking that didactic piece, that understanding of things, and you start applying it to patients and to care. This is not concentrated in San Antonio. This is actually at different sites all over, and we'll go over the list here in a moment, right? This is where you break out. Typically at any site, you'll see 6 to 8 other students that you're working with in different years, right, of education. This is where you'll be seeing patients, putting your hands on patients. You'll have preceptors in different rotations. This is the list of, not an exhaustive list. This is a basic list of every place that you will rotate. So think of this as like your intern year, right? Like for a doctor, as it were, right? Where you're going to go and hit every specialty and get a general understanding of all things medicine. There are additional educational opportunities when you're doing this. There are what we call elective weeks where you can go back and do a rotation at ophthalmology because, man, I really liked ophthalmology. Or you can opt for something else, right? Something that's not even on the menu, as it were. Like, oh, at this hospital, we have neurosurgery. And neurosurgery would love to have one of us come and do a rotation and teach us some really cool, interesting stuff. Great. That's an opportunity for you. Or, hey, what am I going to be doing when I finally graduate as a PA? Like, what does this actually look like? Oh, well, that's another rotation option for you. You could rotate down at the TMC with one of the PAs, right? With doing aid station stuff. What does the day in the life of the PA actually look like? That kind of stuff. So lots of different opportunities available. This is not purely clinical, though. It's not purely putting your hands on patients. Every time you finish one of these rotations, you take a test. You take a final exam in that rotation. Another opportunity, if you are not well prepared, to fail. So it's not just seeing patients in, Monday through Friday and then I'm out, right? You're doing long nights in the ER. You're doing overnights, whatever the case might be. Additional challenges for the family. Phase 2 sites. You can see a plethora of Phase 2 sites. I was at Fort Carson. I was a 4ID Division Senior PA. They have a great program there. But you can also see, this was cool. I didn't even know this was a thing until I was in this position. Landstuhl, right? Who doesn't want to go to Germany for their Phase 2, right? Man, that'd be great. Go to Germany, go to Europe, and do my Phase 2s. I mean, you're not going to have any time to enjoy Germany because you're going to be so busy, but I'm being facetious. But there are lots of opportunities. Tripler, West Point. Notice it says Air Force locations. This is more the exception than the rule. Is it an opportunity? Yeah. Does it exist? Yes. How often does it happen? Maybe one student per class, maybe two per class. It's just working with the schoolhouse on like what you want and why. For some people, hey, my family's from Ohio and, my wife, kids, whatever, they moved back home while I'm doing this. And so if I could get the Phase 2 at Wright-Patterson Air Force Base, I'd be really close. They can come there, that kind of stuff. But not something to plan for. The Phase 2 sites, as it relates to selection, is going to be class specific. When I was, graduating Phase 1 and getting into Phase 2 and doing Phase 2 site selection, it was based on like placement in the class. So you pick your top 3 or 5 and then like, where am I at? I'm number 7 in the class. Cool. So bing, 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 bing. Hey, you're going to get your first choice because we still have slots available there. But I can't say for sure how it would be perhaps when you went through. Some things that will factor in are EFMP. Right. So if people have EFMP, there's some sites they can't go to. Right. So then they would have to plug them into the sites where they can actually go. And also like geo bachelors. Right. Hey, my family's at Fort Carson. I went to Fort Sam. I'd like to go back to Fort Carson to be with my family. So that's another thing that factors into the site selection. Basic qualifications. If you are in a ROTC status, you may not apply. Well, what if I graduate in May and the board's in June, so then I can apply and then still go to the board because I graduate before the thing? Yeah, but the application deadline is 1 March. So you are ineligible to apply. For our reserve, active, or whatever compo, I'll just say whatever compo you are, that's who you have to apply for. So if you're like, well, I plan on transitioning to the reserves, so why don't I apply to the reserves or for the reserve, and then that will just allow me to transition into the reserves and then go to IPAP. It doesn't work that way. You must apply to the compo that you belong to. Other services may no longer apply. This was a very narrow window. Actually, that's how I got into IPAP, was I was in the Air Force and then wanted to be PA. And then the Army was like, yeah, come on down. So that's how I ended up being in the Army. All applicants, no DA photo. We know that's the new thing, right? Redact the photo on your soldier talent profile or any document that you provide, as well as some of the other demographic information. So it says ACFT scores. The most recent MILPER and future MILPERs will, instead of just saying ACFT or whatever, it will identify like the Army's fitness test of record, right? Something along that. You remember not long ago, there was a concern that we may be reverting back to the APFT. There was a little bit of discussion on that. And so What we elected to do is to kind of use more nebulous general verbiage, right? To just say, like, you just have to be current on whenever the PT test is. Height and weight, this is another one that came up. People ask, well, I had more than a 550 on my ACFT, so I don't have to do height and weight. It's like, that's cool. You don't have to do height and weight for command purposes, but you have to do height and weight for this application purpose, right? So it doesn't exclude you from that. You still have to do it. It's written in the regulation as a requirement. And then don't worry about, you'll see these, qualify for an appointment under 4501, 6130, don't go through and read these regulations because they're like a bazillion pages, right? You're wasting your time. That's not your job. That would be my job when I'm looking at your packet, or the medical examiner's job when they're doing your commissioning physical. They do or don't, something along those lines. That's not something for you to worry about. The soldier talent profile must be certified as true. You got to have that stamp signature by either the commander or first sergeant. Doesn't really matter as long as somebody's got that stamp on there saying, yeah, this is real, right? And we know because, the ERBs are no longer a thing. This one is important. This one is one that created a lot of consternation this year. So when the MILPER was published last year, it said 4187, right? Do 4187 for conditional release. And then, 2 weeks later, something like that, the Army was like, psych, everything's got to go through IPSA now. Okay, so then we had to kind of figure out what does that process look like. Now moving forward, a conditional release will be processed through IPSA as a PAR, personal action request. Now, don't get that confused with a 368, okay? The 368 is the conditional release for compos, right? I'm changing one compo to another compo. That's not what this is. I received several of those, had to ping them back and say, that's not what we're looking for, okay? The next MILPER that I publish in July will be more specific. It will tell you exactly what, go here, do this, under that, say this. 601-20 has specific verbiage in it that needs to be included in that conditional release statement. It says exactly, write these words is what you need to say. So make sure that appears in your conditional release. And a security clearance verification memo, at least an interim, right? Like it's interim and we're finishing and it should be done by this date, something along those lines. Nothing is not okay. You see that link right there? 100% you must be registered by the deadline. It doesn't matter if you have a 4.0 overall GPA, a 4.0 science GPA, and you scored a 1400 on your SAT. You will not be boarded if you did not do this. It will not happen. Okay? So 100% do. Earlier is better. Earlier is better. In your packet, you're going to have a CV. There are samples, right? That's the other thing I want to emphasize. If you haven't been to the IPAP website, please go to the IPAP website. It has everything you need there. The MILPER's there. The regulation is there. On the right-hand side are sample documents of every document you're going to have to produce. Every single one. And it's let me download this document. It's in a Word form. Let me just go and change the verbiage in it. Now my name appears and now this date has changed, right? It's very, very user friendly. There's even a checklist for people like, I don't really know what order I should be doing this. When should I start? How should I start? There's a no joke step 1, step 2, step 3 checklist on there, right? It's dummy proof. That 160 is the form you use to just say, I want January, April, or sort it kind of however it is that you might want. For any, to attend class. For any officer, we'll need your DA 71. The cool thing is, way back in, the days that I submitted my packet when, dinosaurs roamed the earth, everything was like hard copy. I'd have to mail it overnight and get the little signature from the UPS guy and then pray that it was there in time, and not a thing anymore. Everything's digital. You submit your packets to us digitally, right, in PDF form, so we can get it like instantaneously. But let me say this. I don't even know how many people submitted their packets to us and never followed up to confirm we received their packets, because, sometimes things get hung up in email and it just didn't go, even though you hit the send button. And then it's after the deadline, and then they're reaching out saying like, hey, I haven't heard back about my packet. And it's like, I never received your packet, dude. And then it's this dance of like, show me the email that shows that you sent me the packet before the date, et cetera, et cetera. So follow through and follow up is important. Other documents, your DA-61, that's the one that's going to help us identify whether or not you need a conviction waiver. Okay, to be a commissioned officer, if you've, have traffic violations, or I beat some dude up in a parking lot, or we got arrested or whatever, right? You'll need a conviction waiver. There's a sample document that shows you, hey, this is the request for conviction waiver that you would fill out. This is the information, et cetera. It's submitted in the packet. Super, super easy. All right. If you possess NCOERs or OERs, they must be in the packet if they exist. Now you'll see down here, it says letters of character for somebody who's not already, say, an E5 already doesn't have NCOERs, right? Because I was an E3 when I got picked up or something, right? Too easy. Now, if I had this happen, hey, I'm an E4, I got the character statement from my first sergeant, cool. Hey, I made E5 now, and I'll be an E5 for like 3 months before the board. Do I need to get them to create an NCOER and then put it in the packet? No. If it exists, it must be in the packet. If it does not exist, you don't have to go and create it. Does that make sense? Cool. Oh, these 1059s, your AERs, when the board is looking at the whole person, right? Like, hey, how are you as on the whole? GPA speaks, right? It's numbers, it's subjective. I can stack numbers versus numbers, which one's higher, which one's lower. But one thing that I think GPA doesn't do is it doesn't say like, okay, but how do you perform compared to your peers, right? 1059s do, right? Your AER, when you went to BOLIC and you were top 10%, you went to ALC and you were top 10%, you went to jump school, you went to whatever, insert phrase here, and you were top 10%. Those are things that tell the board, I put you in a room with 10 people and you're going to be number one. And it doesn't matter what the task is, right? You're going to be number one, maybe number two. That speaks volumes, right? Because the course isn't just academically challenging, it's mentally challenging, it's draining, right? And so do you have the grit to win? That's what it comes down to, right? Are you the person that when the opportunity exists, do you just win?
We are halfway of the presentation. If you made it so far to here, please consider liking this video and also subscribing. I'll appreciate that. Now let's get back to the presentation.
For those who are enlisted and applying, a couple important things. Your GT score, it must be a 110 or higher. There is no exception. It says no waiver, right? I had a couple of people, at like 109. They're like, hey, can I get exception to policy? No, there is no exception to policy. You're going to have to go do some studying, do a retake, and push that GT score up. Okay? There's nothing I can do about that. Physical exams, you must do a commissioning physical. You must meet a session or commission standards per 4501 and the DODI 6130. Like I said, again, not your job. Do the commissioning physical. The examiner is the one that says, oh, I've identified these things. These are medically disqualifying for commission, requesting a medical waiver. And guess what we get to do? Process medical waivers. Right? Say, okay, cool, but we don't care. It's okay that issue is waived. I think this year, the medical waivers were about 100%, right? So high likelihood somebody would have whatever it is waived. And then understand as an enlisted member, you're just as competitive as an officer. There's no advantage for the officer versus you. When you look at the selection, the number each year, we have 100 active duty seats, right? 60 to 70 are enlisted and the remaining are officers. So by numbers, right, you can see the distribution actually kind of favors our enlisted applicants. And then also, if you're not in the medical field, it doesn't matter, right? Overall, right, if you were to say, hey, what's the MOS or AOC that's most often selected for the program? It's 68 whiskey. And then, of course, somebody would say, well, then how does that not favor medical if these are the people who are being selected by the greatest numbers? Because they're also the people applying by the greatest numbers, right? So it's just a simple numbers game. There's no advantage or disadvantage having a medical background or not. Your letter of intent, first line says it all. This is important, super important. This is the only real communication you have with the board. Telling the board, this is what I want to do, and this is why I want to do it, and I understand what I'm getting myself into, right? A lot of people in their letters of intent will say, and I understand this, will say like, I want to do medicine and I want to help people. And those are admirable things. But in no way does that communicate to the board that I understand what I'm asking for and I understand how an Army PA contributes to the fight, which is why I want to do this, right? At the end of the day, an Army PA, the way that we contribute is we help maintain a medically fit and ready force that can fight a war tomorrow, today, right now. That's how we do it. Well, how do we go about doing that? Well, part of it is medicine, taking care of soldiers day to day, but that's just a piece of it. The other part is well, I train my medics, right? So they can be provider extenders, right? Help them help more people, thereby keeping more people in the fight. Well, what else do I do? Well, I also help maintain an organization's medical readiness so that we're, I don't want to say green, but we have more people ready to fight tomorrow if we need to. Well, what else do I do? Well, I also work directly with the commanders and I help with field training, right? And build realistic training for our people, help with mass casualty training and things like that. Again, helping with the mission, helping us fight. So there are a lot of things that we do other than just take care of people in a clinic that contributes to the fight. And it's important to be able to communicate your understanding of that to the board.
What is the average LOI that the board recommends for length of the...
1 page.
1 page?
A letter of recommendation and a letter of intent don't exceed 1 page. I'm just telling you, don't exceed 1 page. On average, the board will have 5 to 7 minutes to look at your packet. And scrolling through a 2-page letter of recommendation from somebody is not maybe the best option, right? Be concise, put it in 1 page. That's what the board wants to see. And then for the love of everything good in this world, please sign it. Please sign it. Attention to detail matters. Attention to detail matters. I'll say it one last time. Attention to detail matters. If you didn't sign your letter of intent and you just sent it in with a signature block on it, the board's going to look at that and say, they didn't even sign the thing, right? How focused are they on what's going on? Another, did you have something else?
Digital signature or just handwritten signature?
Either's fine.
Either? Okay.
Either's fine. Along those same lines, like I said, attention to detail. You're going to send us tabs, tab 1, 2, and 3, and all this is outlined. I don't even know how many I received that were right side up, then upside down, then sideways, and then whatever the case might be. Okay, I think we had 287 applicants this year. I will not go through your packet and correct flip, right? That's absolutely unacceptable. This is a professional officer producing program. That tab is not prepared, not ready to meet the board, okay? We will let you know you need to correct your tab and send it back to us, okay? Now, that said, if you get your packet to us 1 March and you're good, everything's good, we're scrolling through, and we will give you feedback on it. Hey, you're missing this one document, or this is out of date, or there was a signature missing or something like that. We will give you an opportunity to correct it, okay? It is not like this is it, and now you messed this one piece up, and now you're done. You just need to make sure the packet's to us by the deadline, okay? And then at that point, if we identify deficiencies, you will be allowed an opportunity to correct those deficiencies. But if you don't get a packet to us by the deadline, guess what happens? Nothing, right? I can't take it. I can't accept it. Letters of recommendation. So 3 that you absolutely have to have. 1, from your first line supervisor. 2, from commander. So question, what level of command though? What do you say? What level of command do you need a letter of recommendation from?
Definitely from your company.
Company? What about you? What do you think?
I think battalion.
So you think battalion level? What about you? What do you think?
Oh, I would say battalion because they probably know you better.
What if I said that you're all right? Because it says commander. So if the person has UCMJ authority, their signature block says commander, then that's who can write your letter of recommendation. Doesn't matter at what level. Okay, it could be company, could be battalion, could be brigade, whatever the case might be. Now, interesting, I had somebody ask, well, so I'm the lieutenant, I'm the meadow, and my first line supervisor is also the company commander. So if they write my letter of recommendation, can that knock out 2 of those requirements? What do you think?
Yes.
You say yes? What do you say? You say no? It's no. You have to have one from your first line supervisor. That's what that letter of recommendation is intended to be, from your first line supervisor, from written in their perspective. So then if that's the case, and they're also the company commander, now where do you need a letter of recommendation from? Probably from battalion, right? Now you're getting a letter of recommendation from someone who is from a command perspective about you. You also have to have an officer of the profession, one from an officer of the profession, and you can see that USEREC form, right? This form is super important. If this form doesn't exist in your packet can't be accepted, can't move forward, okay? This document is what's used to actually document your shadow hours. It is a requirement to document your shadow hours. It can also be a letter of recommendation. Now, one option that you have is, rather than using this form as a letter of recommendation, you can just use it to document the shadow hours, right? Whoever does it fills it out, do their thing, write up whatever they want to write. But then they could write a memorandum style letter of recommendation for you, in which case, again, this is just for documenting your shadow hours, but it must be there. That form must be used. Now, it says here you can have 5 letters of recommendation. So if you can have 5, how many should you have? 5, right? 5, because we all know the minimum is not okay. Feedback from the board last year was, hey, we actually liked seeing 2 letters of recommendation from officers of the profession. One maybe a junior PA, and then one maybe a more senior PA, brigade, division, something along those lines. Somebody's put some time in. And then that leaves one more. Well, what could this other one be, right? I got a first line, I got a commander, I got my 2 officers of the profession. What can I do with that last letter of recommendation? Well, how much weight can a piece of paper hold? How high can you go, right? Who at what level is willing to endorse you for this program? Right. One thing that might not be helpful is getting a letter of recommendation from your chemistry professor from 8 years ago when you went to Bellevue College or whatever, I don't know, rando school, like probably not going to carry a lot of weight, right? So think through that. Commissioning physicals, the dates are important. Right? I said it before. More than anything, dates are what get people disqualified. Your physical, it says after 1 June. Realistically, it needs to be after the date of the board. So the date of the board finishes 7 June, right? So it would be after that. I tell everybody, the safe date, 1 July. 100% safe. We aren't holding any boards after, 1 July forward, all right? And somebody asked at one of the other briefs, well, so then when should I start on stuff? Well, you could start lining things up now and then start completing things and getting signatures on things with dates on those things 1 July, right? You could go and schedule your physical for 1 July for your commissioning physical, and congratulations, you go, and that's how everything is dated, and then you're good to go, right? No issues. Your letters of recommendation could be built and ready to execute and wait until you can send them, and then you can get those signatures on them. But everything needs to be in that 12-month cycle. Your shadow hours need to be in the 12-month cycle, letters of recommendation, letter of intent, physical exam, everything needs to be in those 12 months. The physical exam needs to be documented on the 2807-1. I will emphasize -1 because if there's a -1, what do you think there also is? A -2. And which one do I not need? The -2. I need the -1. That is a report of medical history. It lets the examiner know all the things I know that are wrong with me, plus my entire medical history, right? It lets them know, okay, now let me look through the regulation and make sure that this person is qualified. And if they're not, they need a medical waiver or something along those lines. And the 2808. Now, I didn't mention this in one of the other briefs. The 2808 must be signed somewhere on the document by an MD or a DO. Okay, medical doctor must sign them, right? We do all the physicals all the time, PAs, nurse practitioners, whatever the case might be. But the regulation says a signature from an MD or DO has to exist on the document, right? Otherwise, it's not valid. So many times I've pinged back and said, hey, you need to take your physical and go get it re-signed because the signature doesn't exist on here. All right. Now you'll see these are labs that you need, right? You need an alcohol screen, a drug screen, an HIV, a UA. Please don't get that confused with a drug screen, right? This is a medical urinalysis checking like protein and other things in your urine, right? And then an HCG, a pregnancy test for anyone capable of bearing a child. These things have to be done. Now, you'll note that when the examiner does this 2808, they're going to annotate on there, right? Okay, so the HCG was negative, the HIV was non-reactive on this date, da-da-da-da-da. Does that meet the requirement, right, that they've annotated all this stuff on your 2808? No. The labs must also be with the 2808. You must also be able to show me, here's the lab, it says negative, here's the lab, it says whatever, right? I have to see those things. And again, this isn't just what I want, this is what's in the regulation. So how are you going to do that? Anybody know? How would you do that? The patient portal, right? Go click, click. Oh, here are all my labs. Screen grab, it's on there, right? Super easy, way easier than it used to be. Permanent 3 profiles are ineligible to apply, and there are no waivers for this. So normally when someone's on a P3 profile, it means that they've been moved into an MEB, right, into the IDES process. But not everybody who goes through the process is medically retired or separated, right? Some are deemed retain, and it's a retain with a different AOC or MOS or something, right? But for many, that they still retain that permanent 3, all right? In those cases, that person is not eligible to apply. Educational requirements, your SAT. SAT has to have been done within the last 5 years, 5 years from the date of the board. Okay, so if you send me an SAT that was done in April and it's in that 5-year window, now you're going to be outside of the 5 years by the time your board meets. Okay, so it must be from the date of the board, 5 years. So just, you got to do a little forward planning. Like I said, dates. Dates are what are going to get you in trouble. All right. Everybody's got to do an SAT. I've had people ask, well, I got an ACT, and then you can kind of do like an equivalent, like, well, what does this equal with an SAT? No go. You got to take an SAT, period. There's no way around this. Minimum requirements, 1,000 or higher combined score. That's the minimum requirement to qualify. Last year's average was a 1236 for a select. Now, don't get disheartened for some folks. You're like, oh, that's not crazy, but that's pretty high, right? Yeah, but that's the average, which means half of everybody selected had one below that, right? That doesn't mean you're not competitive at all. Just food for thought. Every person, every SAT must have a minimum of a 450 in reading and in math. I don't remember what the averages were, but it was, 600 and something per. Definitely recommend you do some study. Don't try and go and swag the SAT, okay? And definitely don't try to go and swag it the last possible day you can take it, because then you might be in a bit of a bad spot if you don't like the score, or even worse, the score doesn't qualify, and that happened to a couple of people this year, okay? The PA CAT, this is new. Last year's application cycle was the first time that we did it. There's no minimum score. The board can't assign points to it, right, as it relates to your packet, but they can see it. At some point in the future, we will have done enough iterations of this that we can kind of develop a minimum. This is kind of where we're at, and this is what we're looking for based on predictive values for success through the program. All right, last year's average was a 519 for a select. You're going to see some of the courses listed here a little bit later, and one of them is you have to have completed a medical terminology course. While, I've seen recommendations to do it in school rather than, there's like through ALMS that doesn't exist anymore, but there's a course you can do just kind of online to meet that requirement, and that's fine. I don't know that it's super beneficial for someone as it relates to PA school to have done the class versus taking the course online. But I will say that if you do not have a medical background and medical terminology is not something that you are around often, it might be helpful to take the class as it relates to taking your PA CAT, because there will be medical terminology and other things used, and you'll have at least an understanding of what they're talking about when they're using some of those terms. It must be completed, cannot be waived, period. Also, there's a deadline, must be taken by the deadline, 1 March, not scheduled by 1 March, not I have it in April, must be taken by 1 March. Okay, there are some opportunities for me to allow for exceptions to certain deadlines based on significant circumstances. There was someone, for example, needed to take their SAT, and then when things changed in and around Israel, they got moved to other locations, and they were very, very busy for a while, and they were unable to take their PACAT and take the SAT by the deadlines, but they were able to take them later. And I was allowed to grant them an exception to that based on exceptional circumstances, okay? I forgot, or it didn't work for me, or I was real busy with this other thing, or whatever. Those are not reasons for me to waive those, okay? But, something like that is. Educational requirements. GPA is not waiverable. Mostly, okay? I know it's not waiverable. Mostly. There's one circumstance where a GPA can be waived, okay? And I'll get into that kind of at the end. So minimum GPA requirement overall is a 2.5. This is every class you've ever taken, ever. Okay. Also, guess what's tied to like your social, right? Like the schools you've attended in the past that have transcripts. And so when you go to the University of Nebraska Medical Center, you go to their site and you start doing all of your stuff for evaluation of transcripts, et cetera, right? Make sure you include all your schools and the transcripts, et cetera. Okay. Because like the systems know that there are schools that you've attended that are linked to your social security number, and they need those transcripts. And what'll happen is some people, and this happened this year, did not disclose some of the schools that they went to. And I think it may have been because of it wasn't very great for their GPA. And then what they got was an incomplete academic evaluation because the school was waiting for those other transcripts because they knew that they existed. Guess what happens if you can't get an academic evaluation from UNMC? Your packet can't move forward, can't go to the board, right? So disclose everything, get all the transcripts to them, let them do what it is that they got to do. We did have one person meet the minimum GPA for overall. They had a 2.49, which is, man, that sucks. I can imagine that really sucked for them. That's not going to get waived, right? It's not. That's go take a whole bunch of layups for the next year, right? Some cheap layups and push that overall GPA up a little bit. Your science GPA, this is where people get a little confused, so I'm going to try to break this down, okay? Your science GPA is based on all science classes that you've completed in the last 8 years, okay? So what happens if you took it 9 years ago? It's not calculated, even if it's a science class, it's not calculated in your science GPA. It's just calculated in your overall GPA. There is no grade replacement. So I took biology and it was terrible. And I got like a C-, but then I retook it and I got an A. So that A is going to move that C off and now it's an A. No, false. It's averaged in. There's no grade replacement. Mostly, again. So here's the caveat. Let's say there are some prerequisite requirements, right? You have to have had anatomy and physiology 1 and 2 and chemistry 1 and 2, whatever the levels those are, in the last 8 years. You must. Well, what if you took anatomy 2, anatomy and physiology 2, and you got a C-, and it was right at that 8-year mark? And then when it comes to apply, that's actually going to fall out of your science GPA because it was too old. And so you had to retake it, right? And then you retake it and you get an A. Well, it does kind of replace it. You see what I'm saying? Because that fell out of your GPA. But if it's in that window, there is no replacement. Now, earlier I said there's no waiver for GPA, and that's mostly accurate. As of this Monday, one of the things that came to light for us was when calculating your science GPA, it's every science class you've had in the last 8 years. Well, what if you haven't had any science classes in the last 8 years, and the only science prerequisite requirements, right, are your anatomy, physiology 1, 2, and your chem, right, 1 and 2. Those are the ones you have to have in the last 8 years. You must. Well, we also allow for applied credit based on your AOC, MOS, or ASI. Some folks will get anatomy and physiology credit simply for being what it is you do, right? Like some 66 Sierra, right? You get anatomy and physiology 1 and 2, you get your 6-hour credit just for being a nurse, right? Just for being that. But if you haven't taken those classes or any other science classes in the last 8 years, and I'm retaking my chemistry right now, right? I'm going to take those because I have to have them, right? So now you're in what we call an academic delay status. I'll cover that. That means that you don't have any classes to evaluate for a science GPA in the last 8 years because you're getting non-grade credit for your anatomy and physiology, and you're taking the chemistries right now, so they're not graded. Well, then you end up with a 0 science GPA. Well, we know that's ridiculousness, right? So in those very narrow specific cases, a waiver can be granted for the science GPA to allow you to apply because you're doing everything in accordance with the regulation. Prerequisites. So this says 60 semester hours. It does not say associate's degree, bachelor's degree, anything degree at all. 60 semester hours. And of the 60, 30 of them must be these. Must be. I want to point out a couple of things. This is important. CLEP. I've had a lot of people say, all right, what about the CLEP? What can I CLEP, right? Can I CLEP the science? Can I CLEP the math? Whatever. English is the only one of these prerequisite requirements that you may CLEP that will be accepted, right? And again, you got to meet that minimum score of 50. Everything else has to be a real class that you really took. Now, does that mean we will not accept any CLEP or the school will not accept any CLEP? I CLEP math, general math, whatever. I got like six hours. Are they not going to accept it? Yeah. In this, not this. So you're still going to have to go take algebra, but in the 60, it can still be applied. Does that make sense? Also with chemistry, right? It must be a general chemistry or higher, no introduction to chemistry. I had a good question yesterday, and they're like, okay, well, what if it's an intro to biochemistry? Well, biochemistry is above general chemistry, and thereby an intro should be fine, right? But it needs to be general chemistry or higher. There is a list of kind of exchange courses, right? This for this is equivalent to this, and we'll take it on our website, right? It's like a full page of classes, so I don't have them memorized. So please don't ask me because I don't know all of them, but you can reference that. And then this is one that I think gets people a little mixed up too. So anatomy and physiology requirements. It's 3 hours of anatomy, 3 hours of physiology, total of 6. So if you took AMP1 and then you took human physiology, would that meet the requirement? 3 hours and 3 hours. Would that meet the requirement? Nobody? So the answer is no, because you need 3 hours of anatomy, 3 hours of physiology, right? And so if you did AMP and then physiology, you'd be getting 3 of physiology and 1.5 of physiology and 1.5 of anatomy, right? That math doesn't add up. So do not mix and match. It is either human anatomy, human physiology, or AMP1, AMP2, right? They need to be the same. Now, like I said, some folks get credit for it, but some folks don't get the 6 hours. They only get credit for 3. Well, then how do we work that, right? You get 3 hours credit, 1.5 of anatomy and physiology. So I've had people say, okay, well, do I need to take AMP1 or do I need to take AMP2 to complete the 6 hours? Either. You will get credit for the other half that is due. So I've recommended to folks just take AMP1 then if you haven't already, because that's the beginning, right? That's the easy stuff. You're starting at and then you'll get the credit for the AMP2 on the backside. Academic delay. So academic delay is when someone is missing up to 3 prerequisite requirements. That's important. Prerequisite requirements that do not total more than 9 semester hours. You can still apply. FYI, that's about half of everybody that gets selected, right? That's not something that works against you per se, because let's be real, even people that already hold degrees, when's the last time they took chemistry, right? A bazillion years ago. So now they're taking it right now, but they don't want to miss that opportunity. I will emphasize credit or number of classes and semester hours. So let's say you're missing your AMP2, Chem 1, Chem 2. Those are the only 3 prerequisites that you're missing, right? And so hey, I'm already registered for these courses. I'll be taking AMP2 with lab, Chem 1 with lab, Chem 2 with lab, right? Are you qualified to apply for academic delay? No, you're not. And the reason why you're not is because when you take these courses that have associated labs, now they're 4 credit hours, not 3. And if you're missing 3 courses at 4 and you're registered for 3 courses at 4 semester hours, that's 12 semester hours. You are not academically eligible to apply. So again, it is useful to have taken the courses with labs, right? That's, something that, yes, the board can see, et cetera. And it is recommended, it is not required. But if your options are take these classes with labs and then thereby not apply this cycle, right, and wait until next cycle, or don't take them with labs, apply this cycle, let's see what happens, right? Let's take a shot on goal. Strongly recommend the second one, right? That's what I would do. We had 3 people this year do that happened to them, and 2 of them were already in courses by the time that came out. And it's like, there's nothing I can do. Like, you're not academically qualified to apply. 1 person hadn't yet started the courses. They withdrew from the course and then got signed up for courses without labs. Now they meet the requirement and they're going to be boarded. Waivers, there are 4. There's a time and service, age, conviction, and medical. Your time and service, I'm not going to make this crazy. This is pretty obvious, right? You can just go through the website and read it, et cetera. It'll kind of let you know. If you've been less than 3 years, you got to have one. Over 15 years, you got to have one. If you've been an officer for 8 years, you got to have one, right? This is super easy. You don't do anything. I do it. I send it up to Corps Chief, et cetera, and they approve them. I want to say age, time and service. I think we only saw 1 or 2 that got denied. And for age, I think we had 10, and it was 6 or 8 got approved. So pretty good odds for those folks needing these. Conviction waivers, there's actually a sample document I think I talked about, right? It tells you, like, this is the offense, this is what's going on, here's supporting documents, you submit it as part of your tab. Super, super easy. And for the conviction waivers, Corps approved, I'd say, probably 60 or 70% this year. So again, pretty good odds that those are going to move forward. Medical waivers, I talked about that. You don't really need to do anything. I review every single medical packet that comes through, every one. And there are many times where I see that the examiner did not identify something that's disqualifying, but I did. I still just move it forward for a medical waiver, right? Not an issue. This year it was right at 100% approval for medical waivers. So not a big holdup for a lot of people. Age requirements, you have to be commissionable, at the age of 42 or before. And for our reserves, it's 47. Profiles, this is important. You know how earlier I said, like, P3s are a no-go, right? Well, what about P2s? If you have a P2, permanent 2 profile in your P, which would be, it could be like respiratory stuff. I have asthma or something like that. I have, abdominal issues, whatever the case might be. You can apply. If you have them in your eyes because you're blind like me, you can apply. If you have them in the H for hearing and you wear hearing aids like me, you can apply. The medical conditions that create the profile require a medical waiver, which is something that we process, not a big deal. But if you have a permanent 2 profile in your upper extremity, lower extremity, or psych, you cannot apply. That said, permanent profiles, permanent 2 in particular, every year as part of the PHA process are to be reviewed by whoever's doing your PHA, right? We look at the profile, and is this profile still needed and warranted? And so there have been times where people were initially disqualified, and on reexamination by whatever specialty placed the permanent profile was removed, wasn't deemed necessary anymore, the condition is substantially improved, and then the person was eligible to apply. Oh, last thing, temporary profiles. You go and you break your leg, like, until that is resolved, we can't board, because at that point we don't know if it's resolved well enough that you're even retainable to the Army, right? If someone is pregnant, that will not let them board. You can be pregnant and apply and be selected, no issues. What we do is we just say, okay, what's your delivery date? What's your parental leave kind of look like afterward? Cool. We will move you to X date, X class, and then you can still attend. Okay, so that's not something that will prevent people from applying. For our enlisted folks, if this BLC, and I'll update this because we know that just changed, right? Like recently, where now you don't have to go to BLC to pin E5. You just have to go to BLC before you can move to E6. And that's kind of the trend moving forward. So this requirement will be, and I clarified that this week with senior leadership, we will eliminate this requirement. So there'll be no BLC. For anyone who is not already an E5, you'll be paid as an E5. Right? Housing allowance, the whole thing. Many times I've been asked, hey, I'm an E4 and I'm going to the JBSA. And so the command's asking about, like, who do I talk to get in the barracks and how does this work? And it's like, there's no barracks. You're going to live out in the economy. You're going to get paid housing allowance, get an apartment or whatever the case might be. And you'll be going to school full time at the schoolhouse. You'll wear OCS rank the whole time. At the end of graduation, when you're done and you're completely done with the program, you'll pin first lieutenant. You'll have constructive credit towards captain. And basically what will happen is you'll graduate, you'll pin, and then the next captain's board that comes around, in about a year or something like that, you go to that, you pick up, and then you wait a little bit, and then you pin. Okay, so it's pretty short thereafter that you end up making captain. For officers, you are detailed on borrowed by the SP Corps or SP branch, but you still technically belong to your basic branch until such time as you complete the course, and then you are reappointed as an SP officer. The only time that doesn't happen is if you're already an SP officer. So if you were a physical therapist or a nutrition or something along those lines, then you would not be reassigned or reappointed. Also, for individuals, for officers, there is a 50% half-time for rank applied towards your rank for retention, right? So the way it used to be was you lose rank right out the gate, report to school, right? You get halftime. Okay, you were a captain. You don't have enough time when we cut it in half to retain captain. So now you're a lieutenant. You go through school and then you promote and do whatever. Now it's not like that. You go to school, no changes in your rank. You go compete for boards, whatever the case might be. Congratulations, you got picked up. You made major. You were major for 6 months while you were in school, and now school's done. And now we're going to do the time calculation. Say, okay, you don't have enough time total to be a major, but you do to be a senior captain. So then you revert back to senior captain, and then you move forward with boards, et cetera, and promote after that. And for warrant officers, such as the unicorn over here, like Bigfoot, man, I think the whole time I've done this, you're the second warrant officer that's come in one of my briefs. Second one's, I didn't think you guys existed. I'll be real with you. People talk about warrant officers. I'm like, they're not real. But for you guys, nothing changes. You wear your rank, and then when you graduate, you're a lieutenant. Nothing different. Degrees and ADSOs. When you finish phase 1, you graduate with your bachelor's in PA science. When you graduate phase 2, you graduate with your master's in PA science. Point of interest for our folks who are enlisted currently applying or are not already commissioned officers. Right now, there's an initiative being staffed. We don't know what the decision will be, that anyone selected for IPAP upon arrival to phase 1 will be commissioned. Doesn't matter if you already hold a degree or not, right? Because the regulation is like you have to either have a qualifying degree or a qualifying degree plan. And IPAP is a qualifying degree plan. So there's a lot of details to work out with this, right? I'm not the one, I can't speak in great detail to it, but it's something that hopefully we will have worked out by this class's start next January. There is an ADSO, 54 months for our active duty folks, and 6 years for our reserve with 2 years IRR. So let me sum this up, okay, for everybody. Master's degree in 29 months. I don't even think that statement does justice. It is a 0 degree. I have no degree at all to a master's degree practicing medicine in 29 months, which sounds like insanity, right? It sounds like insanity. And I understand, right? Let's be honest, okay? There are some trainings perhaps we've received since we've been wearing the uniform that were more like, maybe I didn't learn as much here as I should have, right? Like maybe that's just not the case right now. This is not one of those, okay? IPAP is consistently in the top 5 to 10% of all PA programs in the United States. We beat out several Ivy League schools, Ivy League programs, right? It is a top tier program, just like the physical therapy program is, the occupational therapy program, and the nutrition program. We are top tier programs. It's an opportunity, if you're not already an Army officer, to become one. You have accelerated promotion right out the gate for those folks that, are not already officers. Emphasize this, military and civilian career. I don't know how many times people have asked, well, what are you going to do when you get out? I'm going to practice medicine because I have a degree in medicine and I have national certification in medicine and I have a state license in medication or in medical. So like medicine, that's what I want to do. That's what I'm going to do when I get out. It's not going to be any different, right? This is a profession that doesn't just exist in the Army. And it's an opportunity to continue to serve. I have been in almost 27 years. I was eligible for retirement 7 years ago, right? But I'm still here. And it's because I really, really, really love what I do, like a lot. And, you know, I've said to folks, the second best decision I've made professionally was becoming a PA. And the best decision I ever made was becoming an Army PA. And I mean that genuinely. So I'm done. Does anyone have any questions for me? Because there weren't a lot during this presentation, which is a bit of a peculiarity. Normally I'm like super interrupted constantly and like answering like I have this one time, this friend and blah, and there's this thing at band camp, and it's just like trying to figure out, you know, like the weird answers. So does anybody have any questions for me at all? Yeah.
You mentioned career progression in the Army. What does the hookup rate look like?
Oh man.
Major.
So it was atrocious. I'm just going to be real with you, right? Like it was atrocious because the SP core is really small, right? And so there was the issue of like the stovepiping. You get to captain and then it's really, really hard to pick up major. This is something that has been shockingly been changing substantially over time. I want to say the major primary zone, combined primary and above zone rate last year for major was like 72%, which was a big change, right? When I picked up major in the primary zone, I think it was like 42% pickup. So somehow, some way, it appears as though there is more room opening for us as we move forward. I don't know if that's related to the direction that the Army is moving as it relates to kind of its configuration of medical assets in support of transition from COIN to LISCO environment. I don't know. But I mean, even our lieutenant colonel pickup this last year was, I think, almost twice what it was the year before. So for some reason, there's room opening up for us. Anyone else have any questions at all? Yeah.
Earlier you mentioned that a soldier wanted to go through like a special forces type during the time to do that. If we wanted to accelerate our careers, go to like a ranger bat or a special operation,
those opportunities exist.
We could still somehow, like if we were to pick up, end up moving to one of those battalions, this program would still be offered to us.
Yeah, absolutely. So if I'm understanding correctly, what you're saying is like, what if I go now, right, as an E5, whatever, and I go to Ranger Bat. And then while I'm at Ranger Bat, I want to apply and go to IPAP. That happens all the time. I've got 18 Deltas that apply all the time. I've got Rangers that apply all the time. People from all over the Army doing all kinds of cool, fun, and interesting things that apply to PA school all the time. So the issue at hand is, will your branch chief, will they release you, right? And I have only seen one person who branch was like, I am only amenable to releasing them if it's at the August class date, right? I'm like, well, that's easy. Go ahead and let's approve the conditional release, whatever, and then I'll just make sure that if they're selected, they go into the August class. Too easy. And not only that, even after you graduate, if you're like, hey, I come from this environment, and I'd like to go back to that environment, right? If I was, Ranger, Special Forces, whatever the case might be, absolutely. Those are easy works, right? You work with assignments and they're like, oh, wow, you are Ranger qualified, you're whatever the case might be. We have these vacancies that we need to fill, and you work directly with them to fill those. And also we have terminal degrees. Opportunities for doctoral programs in orthopedic medicine, emergency medicine, like general surgery. We have PhDs for epidemiology that are available. And I was talking with some of the folks about like when to apply for those if after you finish PA school, right? The optimum time to do that stuff. So there are opportunities to do more than just regular medicine. If you're like, actually, I'm super interested in orthopedic medicine, right? That sounds really cool. Great. Well, we have doctoral programs for that you apply for after you've been a PA. Get picked up, go to school. Congratulations. After about 18 months to 2 years, now you have your doctorate in orthopedic medicine. Any other questions for me?
Do you guys actually interface with the applicants' branch managers, or is that the conversation with the applicant will be exclusively?
So you put in the request to branch, do what it does. The approval comes back. You just put it in the packet, no issues. If there is an issue where branch has questions, concerns, right? Oftentimes they just reach out to me, right? But yeah, absolutely. I don't know how many branch managers I've spoken to directly about applicants or people who were already selected. I mean, HRC is like right across the way from me.
For an updated transcript and like SAT scores, if we don't fit that time frame window, do you recommend for us to start college with like a general studies and then just knock out a semester of courses just to get that in the application process, or is there an easier way to?
So I will leave some of that to the ed counselors as it relates to like what course of action you should probably follow related to your degree. I will say that often we find ourselves thinking sequentially, right? Take this, then this, then this, then this. And sometimes it eats up time because that's how the calendar moves. For those of us who are maybe retaking something that they've taken in the past, and it's just, I have to retake it because it's too old, right? Sometimes sequentially works better for time. The trade-off is you have to be mindful that you're not going to shoot yourself in the foot with a bad grade. Right? When I was applying, in order to qualify, I had to retake Anatomy and Physiology 1. I had to retake Chem 1, Chem 2. I was taking, in one semester, I was taking all 4 of those classes from 4 different universities, paying out of pocket, working real hard, getting my A's to get them into the board. But I did it, right? Because that's what I had to do. Again, doing sequential things can be helpful for time, but the trade-off is, can you get the quality grade you need to allow you to continue to be competitive?
Can I piggyback off that question?
Sure.
Melissa, can you go back to the the screen with 60 credit hours required, 30 credits being in class?
Oops, too far.
Oh, sorry, I thought you were running.
No, you're fine, you're fine. There we go.
So, and sir, correct me if I'm wrong, those 60 credit hours, it's credit. It's recognized credit by the college.
Mm-hmm.
I don't know if you all know this, but you all have a JST. Are you familiar with that term? Joint Service Transcript?
Mm-hmm.
That's a record of military training. Well, basically, the American Council on Education has basically looked at your credit, they looked at your training and said, if you learned in the military, why should you have to relearn it in school? And so if the college recognizes that credit, I mean, if you're in the medical field and you have not looked at your JST, chances are at least 30 of those credits that don't have to be in class, you've already done with your JST, with your military training. And so your TA memo, when you get that through Nebraska, and it looks at the classes you have to have, that's what it's probably going to show, that the lower 30 credits there, hey, you're missing A&P, you're missing chemistry, whatever, that's what your TA memo is going to show us, and that's what we're going to pay for. But your JST, that might cover 3 of those credits already, which goes into Clefs and Dantes, etc. You haven't even set foot in class yet. Accurate?
Oh, absolutely. Absolutely. We get the applicants. I don't think I've seen an application without a JST. Everybody submits it. Everybody sends it to UNMC for evaluation, for consideration, for just applied credit for some of those semester hours. So 100% help yourself. Don't take classes you don't have to. All right, so I am done. I will hand it over to Sergeant Perez.
If you made it all the way to the end of this video, please consider liking this video and also subscribing. If you want a copy of the presentation, it's in the description down below. Thank you very much for watching this video all the way to the end. I look forward to see you in the next one. Bye.